So we wanted to talk a little bit about otoplasty today, or ear pinning or ear reshaping, as a lot of patients come for that as well. And this surgery typically takes about 45 minutes per side, and it's for ears that are prominent or projecting from either side of the head or the scalp. This surgery is done from behind the ear, so the scars are really well hidden. We access the cartilage, we weaken it, we place some sutures that help create some new folds, and then we reposition the ear a little bit closer to the scalp. After surgery, you have a wrap on for approximately 5 days. We see you later at 5 days. We remove that wrap and we have you get a headband or a tennis headband that you wear at night. And even through the day for the subsequent week, and then at night for a few months afterwards. The main behavioral changes we ask of you are no swimming, especially in public pools or in oceans or beaches or lakes, but you can shower and keep things nice and clean. We also have to be careful with certain glasses to make sure that there's no pressure on the incision, and no heavy lifting or contact sports for about a month or 6 weeks. But the surgery is really well tolerated. Very little pain medicine is required. And once we get past those first couple of weeks, you're already pretty comfortable in what the result will look like. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com.
Thanks again.